Welcome to FOREContour by Facialteam. Let us explain the technique behind our forehead feminization surgery after more than a decade of experience with over 2,000 patients. First, a 3D CT scan produces a detailed image of the facial structure. Then, with a surgical planning software developed by Facialteam, we determine the type of personalized reconstruction that may be required in each of the highlighted areas. The frontal sinus, an air cavity in the center of the forehead, is analyzed and measured. We may then generate an anatomically accurate 3D surgical guide which permits us to design bone cuts around the frontal sinus with extraordinary precision. This surgical guide is then 3D printed for use in the actual surgery. The procedure starts by choosing the optimal area for the incision, according to the patient's hair density and quality, in order to obtain a future scar that is completely hidden. Then we perform the incision along the chosen area where a strip of scalp is removed. Later we'll explain how hair grafts from this strip may be employed on the same day for hairline feminization. Through this approach, we gain full access to the forehead and orbital region. The surgical guide is then fixed in place. Using ultrasonic technology, a bone cut is performed along the cutting guide. This significantly increases the safety and predictability of the procedure. The anterior wall of the frontal sinus is removed to be sculpted separately in order to preserve its functionality and integrity. Afterwards, we contour the key gender markers of the forehead. Meticulous attention is given to the temporal ridges, supraorbital rim, frontonasal transition, orbital area, and the space surrounding the sinus cavity. Next, the sinus wall is repositioned and fixed with micro screws. If there are any gaps or weak areas between the sinus wall and the surrounding region, a specially adapted titanium mesh may be placed for reinforcement. As a consequence of the anatomical changes, the patient gains expressiveness and the eyebrows settle into a natural higher position. Now, let's go back to when we remove the strip of scalp to talk about the hairline. In the presence of a receding or M-shaped hairline, hair follicles may be harvested from the strip obtained during the initial incision for a simultaneous hair transplant, or SHT. The SHT technique was created by Facialteam in 2013, a turning point in hairline feminization methods. First, a team of technicians extract the follicular units from the strip. After grafting sites are prepared, the follicles are placed for a natural, dense, and more feminine hairline. Our forehead and hairline feminization method, based on over a decade of experience and scientific inquiry, has pioneered techniques for more harmonious, precise, and predictable results. FOREContour, envisioning forehead surgery.